Welcome to Roadmap to Residency. Hello, everyone. I am Aviraz, and let's discuss about testicular tumors. So, what is the most likely diagnosis? 30-year-old man presents with a painless testicular mass that he noticed a few weeks ago. Physical examination reveals a firm non-tended mass in the left testis. Scrotal ultrasound confirms the presence of a hypoechoic mass within the testicle. Serum tumor markers are within the normal limits. A radical orchiectomy is performed, and histological examination is showing a uniform cells with clear cytoplasm and large central nuclei. Then, what is the most likely diagnosis? Leydig cell tumor, embryonal carcinoma, seminoma, York sac tumor, or teratoma. Seminoma, the clinical presentation of a painless testicular mass along with histological feature of uniform cells with a clear cytoplasm and a large central nuclei is highly suggestive of a seminoma. Seminomas are one of the most common types of testicular germ cell tumors and typically present in young to middle-aged men. They are characterized by a homogeneous appearance with large cells and abundant clear cytoplasm. Testicular tumors. So germ cell tumors account for 95% of all testicular tumors. They arise from the germ cells that produce the sperm. The most often occur in the young males, and the risk factors include the cryptorchidism and Klinefelter syndrome. Can present as a mixed germ cell tumor, and they do not trans-illuminate. That's how you differentiate it from a hydrocele. They are removed by a radical orchiectomy. The sex cord stromal tumors develop from the embryonic sex cord, for example, the Sertoli and Leydig cells of the seminiferous tubules, thick and granulosa cells of the follicle, and they are mostly benign. Seminoma is a malignant, painless, homogeneous testicular enlargement, which is the most common testicular tumor, and it is analogous to dysgerminoma. There is increase in the placental alkaline phosphatase, and it is highly radiosensitive. Embryonal carcinoma is a malignant, painful hemorrhagic mass with necrosis, and there is increased HCG and normal alpha-fetoprotein levels when pure. It has worse prognosis than seminoma. Teratoma is a mature teratoma, maybe malignant in adult males. York sac tumor, also called as the endodermal seminal tumor, contains the cellular dual bodies which resemble the primitive glomeruli, just like we discussed in the ovarian tumor video. Choriocarcinoma is a malignant disorder inside trophoblastic and erythroblastic growth. It is a hematogenous metastasis to lung, and there is increased HCG in the patient. Leydig cell tumor is also mostly benign. It is a golden brown color and contains the Reinke cells and produces androgens or estrogens and can lead to precocious puberty and gynecomastia. Sertoli cell tumor is also called as anadroblastoma, and it is mostly benign. And there is something called as primary testicular lymphoma, which is typically in males more than 60 years of age. So these are the hormone levels of germ cell tumors, which you have to remember by heart. And the one thing that you can differentiate is that in York sac tumor there is very high in alpha-fetoprotein, and PLAP is sensitive for seminoma, and beta HCG is sensitive for choriocarcinoma. So ultrasound testis shows solid mass with hyperechoic mass. What is the most likely diagnosis? 45-year-old man presents with gynecomastia, decreased libido, and testicular atrophy. Physical examination reveals a firm rubbery mass in the right testicle. Serum testosterone levels are markedly decreased, while luteinizing hormone and follicle stimulating levels are elevated. Ultrasound of the testis shows a solid mass with hyperechoic areas. Diagnosis should be seminoma, Leydig cell tumor, Sertoli cell tumor, York sac tumor, or teratoma. Leydig cell tumor, the clinical presentation of gynecomastia, decreased libido, and testicular atrophy, along with an elevated luteinizing hormone and follicle-stimulating hormone and decreased testosterone level, is indicative of a Leydig cell tumor. Leydig cell tumors are a rare testicular tumors that can produce androgen, estrogen, or both. And in this case, the symptoms are consistent with excess estrogen production and leading to gynecomastia and other hypogonadal symptoms. Thank you for watching. Keep studying hard.